Facial rejuvenation in general is something that I think a lot of people are interested in, but they're kind of scared because they've seen so many people on TV and celebrities and in magazines that just look terrible. They look so unnatural, they look distorted. It's important to really sit down with them and first of all just show them a lot of pictures. Like, these are all the people who had this thing that you're looking for, and they look great, they look normal, they don't look like they've had surgery. So with the facelift procedure, is really the foundation for the lower half of the face and the neck. Right? It's not for the whole face, it's just for this lower half and the neck. And it can tighten up a loose neck. People say they have the turkey neck or the heavy neck. It can really shape that nicely. It can remove any loose skin from the neck. It can remove the jowls and define the jawline. That's really what the strength of the facelift procedure is. It is not to fix the eyes or to lift this area at all. It's for this area. And if it's done that way, it can look phenomenal. The procedure has to be customized because not everybody ages the same amount or comes at the same time in the aging process. So if people have a little bit of loose skin, maybe a small looseness in the neck, we can do smaller procedures, short scar procedures. Other people who have a very heavy neck, more advanced aging, might need a complete facelift. So you have to really, again, know enough about what these procedures do and have the range of options so that when someone walks in, you don't just do the same thing for everybody, that you customize to the degree of aging that you see in their skin, both in their jawline and also in their neck. I think that's going to give you that nice result. The upper part of the face, which is really around the eyes, has its own little set of procedure. And again, you have to look at each area, the upper eyelid, the lower eyelid, and then the volume of the face. It's not just about parts, it's about everything blending together. And part of aging is to see that the face is becoming thinner and hollow in certain areas. So the procedure that we use in the upper face, upper eyelid lift, which removes the loose skin from the upper eyelids, that procedure, in my opinion, is usually overdone. A lot of people have this eyelid surgery and they actually end up looking too hollow. They take out too much skin and fat and muscle and the eyes almost sink in and look tired and older. The trick there is to only take out a little bit of skin, and that's it. Leave the fullness so that it looks very natural, but restores the contour of the eyelid. They don't feel that heaviness in their eyelid, and it lets the eyes open up better. The lower eyelid is a little bit different. It's a combination of loose skin, which you can tighten with a little incision, but it also has differences in fat. Some people develop fat pockets under the eyes that look like bags. So those fat pockets can be reduced to make the bulge go down, but they also have hollowing under that, which most people don't address. And that's a mistake because then you can still look tired even when you're done with the surgery. So what do we do for that? We fill it and we use your own fat, which is a really excellent technique, fat injection or lipo injection. We take some fat from the other parts of the body where people are always happy to, to get rid of it. And we, instead of throwing it away, we can use it to fill in the hollows under the eyes. It can be used for the temples that get hollow. It can be used for the cheeks where they get very flat in the folds of the smile lines. So it's a really excellent technique because it lasts for many, many years and is very, very natural. It's your own fat. So when you combine that filling of this area with that tightening and definition of the lower face, that shape that we create, that sort of V shape, that lifted shape, looks very natural and very youthful, and also gets rid of that tired, aged look.